Do you live or spend time in grassy and heavily wooded areas where ticks and mites thrive freely? It's very important to take some common precautions in tick-infested areas for the protection of your little ones from Lyme disease.
If you don't treat Lyme disease on time, it can turn into an inflammatory disease that affects multiple systems, starting with your skin, joints, and nervous system and moving to other organs later on. Hi, welcome to Live Sound Health, and in today's episode we will discuss about the various symptoms and treatment options available for neurological Lyme disease. But before moving on, make sure to hit that subscribe button and turn on the bell notification for our future videos. Neurological Lyme disease occurs when the bacteria responsible for causing Lyme disease affect our body's central or peripheral nervous system. Lyme disease can affect our central nervous system. When it occurs, the condition is commonly known as neurological Lyme disease. Neurological complications can be seen in the early disseminated Lyme disease, with facial palsy or paralysis of facial muscles, skin numbness, weakness, pain, and sometimes visual disturbances. On few occasions, symptoms of meningitis such as fever, severe headache, and stiffness in the neck are also observed. What is Lyme disease? Lyme disease is a seasonal tick-borne infection, which is caused by the bacteria Borrelia burgdorferi. It is the primary causative organism responsible for affecting various organs and systems in our body. Symptoms of neurological Lyme disease. Some commonly known symptoms of neurological Lyme disease are headache, facial weakness or paralysis, weakness of limbs, facial palsy, dizziness, cognitive and memory difficulties, difficulty seeing, slurred speech, impaired concentration, and slurred speaking. Patients also experience paralysis of the tongue, eyelids, vocal cords, and sometimes of the eyelids themselves, also known as palpebral palsy. Diagnosis of neurological Lyme disease. Frequently, neurological Lyme disease symptoms cannot be noticed by regular or a routine physical examination. The primary reason is that most symptoms are due to nerve pain and numbness, which are highly nonspecific. If you are a patient with Lyme disease, you may undergo a neurological evaluation to rule out other neurological diseases. However, this evaluation will not rule out possibility of Lyme disease. You must obtain the most objective and accurate diagnosis possible to get the correct treatment. Sometimes Lyme disease can appear to resemble several other neurological conditions also. Who can be affected by neurological Lyme disease? Lyme disease can affect people of all age groups. The ticks that cause Lyme disease are found in moist and humid environments. To decrease the risk of getting Lyme disease, alertness and profound precautions are highly advisable. We should use a good insect repellent in the yards and the corners. We should do our best to make our yard tick-proof. We should thoroughly check our children and our pets for any presence of ticks. We should promptly remove a tick as soon as possible by using good quality tweezers. Treatment options for neurological Lyme disease. The good news is that with appropriate treatment, almost all neurological symptoms will disappear within a month. Medications for the treatment of Lyme disease are very effective in treating the symptoms associated with neurological Lyme disease. Antibiotics are the most preferred choice in the treatment of neurological Lyme disease. If you experience symptoms like numbness or severe headache, seek treatment immediately from your physician. Find that your neurological Lyme disease symptoms persist beyond the standard time frame of 1 month or any other problems interfere with your quality of life. A Lyme neurologist may be a good choice for treating neurological Lyme disease. Hope you found the video informative. Do like, share and subscribe our YouTube channel. Also visit livesoundhealth.com for more such pieces of information.